In clinics and hospitals around the world, the vast majority of healthcare providers adhere rigorously to safe injection protocols during every procedure. A safe injection is defined strictly as a medical procedure that neither harms the patient nor exposes the healthcare provider to avoidable risks. But while uncommon, unsafe medical injections do happen. They occur when the physical, mechanical steps of aseptic technique break down. This failure usually stems from two distinct mechanical errors: the reuse of a needle or syringe, or the clinical misuse of medication vials. Because these breaches happen at a microscopic level, they bypass our natural defenses, turning routine preventative care into a direct vector for severe patient harm. To understand how this contamination happens, we need to distinguish the tools. A syringe is the instrument used to inject or draw fluids from the body. The needle is the sharp, pointed object used to physically pierce tissue and access those fluids. The absolute non-negotiable rule from the CDC is that a healthcare provider must never reuse a needle or a syringe on more than one patient. Here is why. After a single use, microscopic pockets of residual fluid and blood remain trapped within the tiny lumen of the needle. If introduced to a new sterile environment, the trapped fluid is pushed out, carrying those pathogens along with it. This specific mechanism transmits severe viruses such as hepatitis C, hepatitis B, and HIV. The same microscopic pathways easily transmit dangerous bacterial and fungal infections. Reusing a needle or syringe is a critical mechanical failure. It physically pulls infectious disease from one source and injects it directly into another. Preventing the spread of these pathogens requires strict adherence to correct aseptic protocols. The primary rule of disposal is immediate action. Providers must discard both needles and syringes into proper sharps receptacles the exact moment they are used. The medication itself is also regulated by strict handling parameters. A single-dose vial is classified by the FDA and CDC based on its specific volume and lack of antimicrobial preservatives. This means that a specific bottle of liquid medication is approved for use on exactly one patient for a single procedure or injection. Extracting medication from this vial requires the mechanical action of drawing the fluid out using exclusively fresh, single-use instruments. We see this standard administration practice most frequently during routine preventative care, such as the delivery of seasonal vaccines. Providers typically target the deltoid muscle in the upper arm as the primary administration site for these single-dose vaccines. Treating single-dose vials as strictly single-use guarantees a closed, sterile loop, carrying the medication safely from the manufacturer directly into the patient's tissue. The protocol shifts slightly when handling a multi-dose vial, which is uniquely recognized by its FDA-approved label. The clinical utility of this bottle is that it contains more than one dose, allowing providers to efficiently deliver a variety of medications and vaccines across multiple patients. This creates a central clinical tension. Providers must safely access a shared liquid resource without causing cross-patient contamination. The absolute safeguard is mechanical. Healthcare providers must use a brand new needle and syringe every single time they access the contents of a multi-dose vial. These vials often hold larger or more varied medication volumes, which are frequently administered into the vastus lateralis site on the outer thigh. This 3D animated diagram shows the invisible, cascading consequence of breaking the safety roll and reusing a syringe to draw from a shared vial. The contaminated needle penetrates the septum, releasing trapped pathogens that rapidly disperse and contaminate the entire shared liquid reserve. Compromising a multi-dose vial transforms a localized quantifailure into a systemic threat for every subsequent patient who receives medication from that exact same bottle. These strict safety practices extend beyond basic vaccines to the administration of complex intravenous medications. The same single-use rules apply equally to oncology wards delivering chemotherapy, clinics performing cosmetic procedures, and facilities offering alternative medicine therapies. Even the most routine clinical actions, such as using a bag of saline to flush IV rinds and catheters, require identical, strict adherence to single-use equipment. The delivery of anesthetics for outpatient surgical, diagnostic, and pain management procedures, often mapped to advanced injection locations like the ventrogluteal site, follow these exact protocols. Regardless of whether the fluid is a complex chemotherapeutic agent or simple saline, the mechanical rules governing the needle and syringe remain absolute. Uniform adherence across all administration types, from superficial access to deep intramuscular injection, is the only way to effectively insulate the clinical environment from the spread of infection. In complex, high-pressure healthcare environments, unsafe injection practices do sometimes occur. When a facility identifies a breach in injection safety, an immediate clinical protocol must be followed. The provider has an ethical and clinical responsibility to swiftly notify any patient who might have been affected. There is a strict requirement to inform these exposed patients that they need to get tested immediately for bloodborne pathogens. Patient understanding plays a vital role in this process. Individuals are encouraged to directly talk to their healthcare providers about safe injection practices before receiving treatment. Clinical transparency and rapid corrective action serve as essential secondary defenses when the primary mechanical barriers fail to protect the patient. This video tracks a reused syringe versus fresh equipment. Compromised instruments contaminate the vial, injecting pathogens. Sterile tools maintain safety and are immediately discarded. While the physical differences in these actions take only seconds to perform, their clinical outcomes are absolute opposites. One spreads systemic disease, the other ensures optimal patient healing. The core rule established by the CDC is straightforward. Safe injections require zero reuse of equipment on more than one patient. The critical secondary rule is equally strict. There must be zero shared access to multi-dose vials using compromised needles or syringes. Adhering to these precise single-use parameters cuts off the primary vector for severe healthcare-associated infections. The ultimate mandate for a healthcare provider is to understand the mechanics of contamination and to execute every step of the aseptic process flawlessly. Strict adherence to safe injection practices protects the individual patient from harm. It preserves the integrity, safety, and trust of the entire medical system.